Hi everyone, I'm Dr. Faisel Sayed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege. Today, Dr. Dan and I are talking about how leading is listening. Let's dive right in. Hey there, Dr. Dan.
Hey, Faisel, how are you?
I'm doing well. I just heard from a patient doing very well with, you know what medication?
No, I have no idea. You're not giving
Water.
me a lot of water. Okay.
Water.
What are you,
So
what are you treating with water?
yeah, and that's what I'd like to talk with you about today. So we went to a nursing home yesterday on Wednesday. Wednesday's my clinic day, so we went to a nursing home. There was a patient that we lost to care, and not a nursing home actually. No, it was an assisted living facility, and we go up to the room. Patient's not in her room, and when I was asking for her neighbor next door said, "Oh, she's probably down in the cafeteria." So I was with one of our nurses, head down to the cafeteria, and we get to the cafeteria, and the patient's over there with three of her girlfriends, and they're deciding on a meal to eat. Now, this was the first time that I met the patient, but she knew the nurse very very well. That I was with, and she hugged the nurse, was very excited to see her, and and I noticed that she didn't have a cup of water. Her three girlfriends had a cup of water, and when I asked her, I said, "Hey, how are you feeling today?" She said, "Well, I've been feeling really lousy this last week. And in fact, I woke up this morning with a severe headache, and they gave me a Tylenol number 3." And she said, "I still don't feel well." And I said, "Well, I noticed that you don't have any water. Your friends have water. You don't have any water." And she said, "Oh, I don't like drinking the water at this place. The water tastes terrible. And I haven't been able to go out and buy water because of how hot it is here in Florida and the allergies and pollen. And also, she hasn't been able to get water." I said, "So how long has it been since you've had any water?" And she said, "It's been over a week."
So, how do you get by without water?
Yeah. So she's just drinking. She said, "Well, I'll drink some cranberry juice here and there," but she hasn't been drinking any water. And 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 so when you're really thirsty, with most things, we usually, if somebody offers us a coffee or a soda or something, say, "No, no, I'm okay. I can get it myself," right? But when you're really thirsty, when most of us are really thirsty, you won't suddenly all of that politeness goes away. If anybody could offer you water, you'll say, "Yeah, I'll take it. I'll take it. I'll take it." But there's a desperation. There's something unique about water when you really want water, to drink water. Suddenly, a lot of the formalities go away. And so I asked her. I said, would would you like me to go get you some water from the grocery store? The grocery store is across the street. And she looked at me with a look like, "Yes, please." I'd be so grateful. And she said, "And then while you're going to get me the small ones, because I can't, the big ones are hard for me to drink." And it was like $3 or $4, Dr. Dan, for like a case of water. And and she was so appreciative. We checked on her that night. She was feeling so much better. It's amazing what water can do when you need some water. She was able to walk down to the cafeteria where she had a walker that she was able to get down over there. In my mind, I was debating taking her to the center. The thought in my mind was, should I give her some fluid, IV fluid, or would she be okay with oral rehydration? She was fine. I checked on her this morning, and she's doing great. Very appreciative of the water. But that's what we have going on in healthcare today. The giving the pain medicine for the headache, and not taking it. It didn't take too much time. And this was a patient I didn't even know.
But it did. I mean, you had to check into what world was she living in. You had to check into her world, not what was the problem, but what was her sort of global existence looking like at that time. It's not a I've read a lot of medical textbooks, and there's not a place in the medical textbook that says ask the patient if they have trouble getting to the grocery store to get water. I mean, that's just you in Florida in the summertime. that could be a pretty big issue, but it doesn't come into any of our checklists to look into.
Sure, sure, and not to be judgmental either. You know, if you're thirsty, why not just why don't you drink the tap water? Everybody else is drinking tap water. Well, she didn't like the taste of tap water. You know, that's okay. She didn't like the taste of tap water. But really getting, I feel like if you just a little bit of empathy with some compassion can go so far with patients, because there's nothing wrong with giving a Tylenol. Well, this was a Tylenol number three. I don't know if I give a Tylenol number three for a to a senior citizen, but giving a Tylenol to get rid of a headache, or an Advil or whatever, is appropriate. Just like when we speak about the home insecure insulin dependent diabetic, the home insecure insulin dependent diabetic who keeps his insulin in his pocket. You know, his body temperature is almost 100 degrees. That insulin is pretty much useless within a couple hours. And as he's getting each toe amputation, medically, it's the appropriate thing to do. You have a black toe, you amputate that toe, right? And each time that's $10,000. We as a society are perfectly okay with paying $10,000 for each toe amputation, and then you've got the partial foot amputation, and then he's got the full foot, and then the below the knee and above the knee, and paying God knows how many tens of thousands, if not over $100,000 for all the amputations. And with each one of them, you know that poor person's sense of independence goes away. But then when we talk about, hey, making sure that helping this person have a refrigerator to be able to store his insulin, or a $50 pair of sneakers, that's safe. He's had surgery. He has the surgery done, and he puts on his same shoes that still smell like the rotting digits that were cut off from before. But when you can't talk about getting him a $50 pair of sneakers, or making sure he has a safe, for a reliable refrigerator for his insulin.
Right. Yeah. No, you bring up a good point, and yeah, of course, what I've been spending some time thinking about recently is doctors in communication and how we communicate with doctors. And I just sent you the thing earlier. I was, and I don't remember what podcast I heard it on. It wasn't Fastland Friends, but there was a podcast talking about the clergy project, and apparently it is a support group for ministers who no longer believe in the faith that they are hired to work in. They're the minister of a Christian church. They don't believe in God anymore, but their life depends on them, you know, supporting other people who believe in God. And so they have this whole group that sort of helps support each other through these times. And I've just wondered, how often is that happening to our colleagues in medicine that are feeling like, they know these expensive procedures, the unnecessary amputations, the giving chemo infusions when an oral targeted therapy might be best, but yet their business depends on that infusion center. And I just wonder what kind of moral injury we're asking these doctors to suffer, and how we have these communications with them.